Hi, everyone, and welcome to our wound care micro session series. I'm Sarah, Director of Clinical Education with Wound Care University. In these short sessions, 10 minutes or less, we'll tackle one high impact topic at a time so you can take a practical pearl back to the bedside today. Today, Dr. Gitterle discusses hyperbaric oxygen therapy and cancer.
Hello, everyone. I am Dr. Marcus Gitterle, Chief Medical Officer of WoundCentrics LLC and faculty member of Wound Care University. This short talk explains whether hyperbaric oxygen therapy, HBOT, is safe for people who have cancer now or had cancer before. It is a summary of Mohn and Stewar's 2012 review, which carefully examined the evidence. The bottom line up front: when HBOT is indicated for another medical problem, using HBOT does not increase the risk of cancer growth or recurrence. This presentation is designed for clinicians, especially those cautious about recommending HBOT to patients with a cancer history, and for patients and families who want clear, plain language answers about safety. Hyperbaric oxygen therapy, or HBOT, means breathing 100% oxygen in a pressurized chamber. The higher pressure dissolves more oxygen into the plasma, increasing delivery to tissues, even when blood flow is poor. HBOT is a standard treatment for conditions like decompression sickness, carbon monoxide poisoning, hard-to-heal wounds, and late radiation injury. With modern protocols, complications are uncommon. A long-standing fear was that extra oxygen might feed cancer, speeding growth or causing recurrence. Mohn and Stewar's review, 2012, along with earlier systematic reviews, does not support that fear. Across many studies in cancer types, HBOT did not promote tumor growth and did not increase recurrence. This is the key safety message. If a patient needs HBOT for a legitimate indication, having cancer or a past history of cancer is not a reason to withhold HBOT on the grounds of tumor stimulation. The authors summarized studies from 2004-2012 and placed them alongside older data. No tumor promotion signals were evident. Across diverse models, HBOT did not make tumors grow faster and did not raise metastasis rates. In certain models, e.g., some breast cancers and gliomas, HBOT was linked to more cancer cell death, slower growth, or biological shifts suggesting less aggressive behavior. Angiogenesis, new vessels. Unlike in normal wounds, HBOT did not boost tumor angiogenesis in multiple studies. Some showed anti-angiogenic trends. Metastasis, no increase with HBOT. In some cases, biology shifted toward a less invasive phenotype. Clinical takeaway: these findings support the safety of HBOT when it's indicated for another problem in patients who also have or once had cancer. If your patient needs HBOT for a standard indication, e.g., radiation injury or a complex wound, Mohn and Stewar's review supports proceeding. There's no evidence HBOT increases tumor growth or recurrence. You do not need to delay HBOT solely due to a cancer diagnosis or history. Document the indication, use standard protocols, and communicate clearly with the oncology team, just as you would for any multidisciplinary care. What does this mean for patients and their families? If your doctor recommends HBOT for a problem like a non-healing wound or radiation tissue injury, the best available evidence shows HBOT does not make cancer grow and does not cause it to return. In approved uses, HBOT is considered safe. Will HBOT ever become an adjunctive cancer treatment modality? Mohn and Stewart also review HBOT as a potential helper with chemotherapy. Hypoxic tumors can be less responsive to some drugs. By temporarily increasing oxygen, HBOT may improve chemotherapeutic drug effects in certain settings, especially if the drug is given during or soon after an HBOT session. A few agents, e.g., doxorubicin, bleomycin, may have added toxicity with HBOT. That doesn't necessarily contraindicate HBOT, but it means we need to be aware of the chemotherapy regimens our patients are taking or have taken, and either delay HBO treatment for 6 months in the case of cisplatin or in the case of doxorubicin Simply stop the drug before beginning an HBO treatment regimen. In these situations, the safety concern is drug-specific toxicity, not HBOT feeding a tumor. In conclusion, for routine, non-oncology indications, the safety message is unchanged. HBOT does not increase cancer growth or recurrence. When HBOT is indicated, offer it. Don't withhold it due to a cancer diagnosis alone. Coordinate with oncology if the patient is in active treatment to assure compatibility with chemotherapeutic regimens and overall patient management. And if you've been advised to start HBOT for a recognized medical reason, you can proceed with confidence.
Thank you for attending this wound care micro session. We value your commitment to patient care. We'll be back with another focused topic soon. See you next time.